I don't know if I told you about this surgery.
No. So you told me you were having a surgery at some point, but I feel like it was.
Yeah, so it got like rescheduled a couple of times and for different various reasons. But the gist is I'm having upper jaw surgery. So they're breaking my upper jaw here and down here. They're drilling in a palate expander that I'll be wrenching open for like 6 weeks, and it's going to bring my jaw open because I have this crazy, really narrow, high palate, if you look.
Oh, yes.
So it's just been a really crazy journey that brought me to this point. It started with my older. When he was born, I discovered that he had a tongue and lip tie, and I brought him to Dr. Siegel in New York City. I had him look too. He's like the specialist. That's all he does is lip and tongue ties, and he said that I had one too. And so I think that's kind of what sparked my interest in Googling it, starting to look into it. And it was at that point that I realized that when I looked at all the repercussions of having it, you can have a slight, any degree of a lisp, and I do have a slight lisp that I've always noticed about myself, but that's kind of the least of the concerns with having a lip and tongue tie. I saw on their upper neck pain, which I've been suffering for like 25 years. So I started seeing chiropractors, and I actually went to a trauma doctor when I was living in Spain for 4 years, and they did an MRI, and sure enough shows between discs 1 and 2, 2 and 3, 3 and 4, and also the x-rays show the curve in my neck is the opposite direction of what it should be. If it should be like this, my curve is like this. And all the doctors I've seen over the last 25 years about it said that you're not born that way. It could only be from like severe trauma, like a very serious car accident. It's basically equivalent to having really bad whiplash. And I could never think of any car accident that I had ever been in, nothing that I could think of. But then when I looked into the tongue tie, it started dawning on me the connection to everything. So basically, if your tongue is tied, it can't move freely. And if it can't move freely, when you're sucking as a baby, when you're nursing either bottle or breast, that sucking motion is helping your tongue helping your tongue to expand your palate, and you're actually born with the jaw not connected here, just kind of how the skull comes together as well. So the surgery that I'm going to be having is kind of mimicking the breaks that would be there as a young child, but it's widening as you're sucking, and also just being a normal nose breather, your tongue rests in your mouth at the roof of your palate. And for me, my tongue couldn't do that because it was tethered, so it couldn't rest there. So I have been a mouth breather my entire life. So being a mouth breather, in order to have the airway open, your head hangs forward. It might not even be that much, but it's enough to. After decades of doing that, I actually am the one who caused my neck to be curved in the wrong direction. So in the end, I discovered in my 40s that it's not actually from any trauma that I had. It's from decades of hanging my head forward to be a mouth breather, which we're not meant to be. We're meant to be nose breathers. At this point, I thought the damage was done to my neck. So because I've already just known in the last 25 years, there's no surgery that can make your neck curve in the right direction again. At the most, maybe they can make the neck be straight, but there's nothing to make it go to curve the other way. But in my case, I was discovering I couldn't have any success of changing my neck because I still hang my head forward to breathe through my mouth. So nothing would ever change if I have this postural problem going on, which is from the way I breathe. I kind of just, it was a depressing thing to find out that that's why my neck is like this and there's nothing that can be done about it. So I kind of forgot about it for a while. And then a couple years later, so this is about 2 years ago, that same chiropractor, Dr. Brayton in Hoboken, went to a conference, and there was somebody who presented there about how adults could have their palate expanded. Normally it's something only done like through teenage years. But she saw a presentation that you could have this done as an adult, that there are appliances that you could put in. So she helped me find somebody local, and I went and I started looking into the benefits of being a nose breather. There was actually like a special I heard on NPR by this guy. His last name is Nestor. He wrote a book named Breathe, and that was kind of an aha moment as well. So this is a couple of years later. I'm listening about how we are meant to be nose breather. It's just that the overall body health of being a nose breather, we are meant to be that way. So that started, sinking in. I thought, oh my God, this is pretty bad that I'm a mouth breather, and I wish I could change that. So I was thinking that if I could expand my palate, then maybe there'd be room for my tongue in my mouth and I could learn to be a nose breather. So I went to this orthodontist, and he basically said that my palate is so narrow and high, I'm so extreme, that I am not a candidate for a regular appliance. The only possible solution for me would be getting jaw surgery, like double jaw surgery, very serious surgery. So when he told that to me, my immediate reaction was just like, no way, just to be a nose breather, I'm just gonna be a nose breather for the rest of my life. Like, I thought that I was gonna be going to him and he was gonna tell me I could have an appliance, we were gonna fix this whole thing. But when he told me about this scary surgery, I just said, forget it. In the meantime, he told me once from that point, I should, because I filled out a questionnaire and I knew that I had sleep apnea. Anybody that I slept in a bed with always told me I stopped breathing in the night. It's like really bad. The snoring is extremely loud. And my father has sleep apnea, so it was something I was familiar with. So, but life got busy. I had kids. I kept saying I need to have a sleep study and get this like officially diagnosed, but I never did. So that orthodontist, his main focus is on airway health. So I really was in the best hands seeing him. I thought I would probably never see him again because I didn't want to go the route of the jaw surgery. So at that point, he told me, why don't you go see an ENT and have an examination of all your sinuses, find out that make sure there's not a reason that you can't be a nose breather. And then from that point, he'll refer you to a pulmonologist, and he'll have the sleep study and everything. And because his main thing was get the sleep apnea taken care of. It's extremely dangerous to live with sleep apnea. So I heeded his advice, went to the ENT, got CAT scan of all my sinuses. Nothing was wrong. I had no polyps. I had nothing. I have a slightly deviated septum, but I feel like everyone in the whole world does because we're just not symmetrical. So, and even that ENT said it wasn't enough to be detrimental to my breathing. So then I was sent to a pulmonologist to get the sleep study. Sure enough, yes, I have sleep apnea. I had the sleep study at home. And then I got connected to the company that sends the PAP machine. The one I got was called an auto PAP, which I think is like the top of technology compared to the CPAP, or maybe the BiPAP is the best one. But anyway, I was sent an auto PAP. Somebody came to my house to deliver it, trained me how to use it. My dad has been using one for 40 years. So in my mind, this was going to be the solution. Around this time, I was really started researching more about sleep apnea, and I was actually starting to freak out a lot because you're not getting enough oxygen to your brain at night. It increases, I don't want to be quoted wrong, but it's a very high percentage, let's say 50 or 60% increase in chance of Alzheimer's, stroke, heart disease. Not getting enough oxygen to your brain every night is very serious. So I kind of was pushing the sleep study off for like decades, not realizing how detrimental having sleep apnea was. So all of a sudden I was kind of like really hot on this. I wanted the machine I didn't want to wait one more day for the machine to arrive. I was just really anxious to get started with the machine, knowing that it would be my solution and I would get enough oxygen to my brain every night. So the guy delivered the machine, and that first night, when I used it, I had to get the full face mask because I'm a mouth breather as opposed to just a nose thing. So I got the full face mask, and every time I inhaled, there was like a really big puff and my cheeks would just like blow out. And I was basically like ingesting all this air instead of going in my lungs. It was going into my esophagus. It's called aerophagia, I learned later. So that whole night I thought that it was my problem. I just need to get used to the machine. This must happen to everybody. Maybe I need to I'm too tense or anxious when I'm wearing the machine because it's kind of a weird feeling wearing the machine, and maybe it's my fault. I need to relax more. So I tried to tough it out that whole first night because I thought it was me and I needed to get used to it and I was doing something wrong, and I would kind of fall in and out of sleep, but that puffing thing was happening. It was kind of like hanging your head out of like a window going 50 miles an hour. Like I just felt like my cheeks were puffing every time I inhaled. So the next morning I had the craziest gas bubble pain of my entire life. Once I got up and started moving, I was like on the floor writhing in pain. My husband thought he had to bring me to the hospital. We didn't know what was wrong. But I had ingested so much air overnight by trying to wear this thing. So luckily, just being in fetal position on the ground made it go away. He was like Googling, what can you do? And it said fetal position, which I was. But it took like 15 minutes. It was one of the worst pains I've ever felt. So I called the pulmonologist, and everything has kind of seemed unique on this path to a lot of doctors. She herself acted like she hadn't really heard of this happening, and it was kind of confusing to her. So she petitioned for the insurance company to cover a hospital sleep study, which is kind of the gold standard. You have a lot more wires hooked up to you and everything. So I went to the hospital sleep study. In my mind, I was going to get there and they were going to put all these wires on, and maybe I didn't know I had the aerophagia, or I didn't put two and two together yet. I thought that it seemed to me it was too much air coming in, even though it was supposed to be an auto PAP that was adjusting the air. I thought that maybe I needed this other machine BiPAP that was be very, very specific amount coming in, and that was the problem. It just seemed like too much. So I thought once they hook up all these things and they observe me overnight, they collect all this data, they would find out that they need to make an adjustment in the amount of air coming in. However, once I, signed in and got into the hospital for the evening, and he wheeled everything in addition to all the things he was wiring me up with, he also had a BiPAP machine. And I'm not a doctor, so I don't understand why you're using a machine while you're having all these things. I thought they would want to monitor how many apneas you have a night and what you need without wearing anything. So, but that's not how they do it. So you wear it while you're having the study. So I told the technician there, I don't think this is going to work. I didn't realize I was going to have this machine. I'm telling you, it's going to make my cheeks puff out. He said he's been doing it for like 25 years, has never heard of what I'm describing about this puffing thing. Sure enough, I put the thing on and it happened again. So I was just determined to make it through this hospital sleep study. And again, barely slept on and off all night with the puffing of the cheeks and everything. And I ended up calling the guy to come in around 4 a.m. I'm like, this is not working. You're not going to even have data of me actually sleeping, because I'm like delirious from not getting any sleep from all this puffing that was going on the entire night. And he said, do you want to go home? You just have an hour and a half left. So I just said, I guess I'll just stick it through. I don't know what kind of data you're going to have. So I talked to the pulmonologist a day or two later after she read anything and everything, and sure enough, it was all, weird readings, because I was just like awake and asleep and kept being woken up. I had the gas pain again, not as bad as the other time, but it was pretty bad. So at this point, I started connecting all the dots and realizing that I think it's an anatomical problem, that something's going on that is making this happen. And even Googling, I really couldn't find out that much. I did get to the term aerophagia, which the pulmonologist said, yes, that is the term for when the air is going in your esophagus. But she had no experience she was referring to it as I can't tolerate the machine. I guess that's a medical term, but to me it kind of meant like there's something wrong with me that I can't tolerate the machine. I'm kind of laughing, like I don't know who could tolerate hanging their head out a window going 50 miles an hour while you're trying to sleep. So I ended up calling up Dr. Rayfield, the orthodontist, who I had not seen in a year, to kind of update him and tell him, all this past year I went through all these things and saw the ENT, saw the pulmonologist, had the sleep study, then had to have a hospital sleep study. I'm calling you because the PAP machine's not working for me. And I was pretty upset, because I just thought that was going to be the overnight solution, and I was going to be able to have oxygen at night. And this was becoming very grim to me, that this wasn't going to be the solution. So he again said, let me give you this surgeon's number, and at least go in for the evaluation and hear what he has to say and everything. So I made that appointment. I went in to see him, and he agreed that he sees people and does these jaw surgeries to solve sleep apnea. There are some people who don't want to wear a machine their whole entire life and get this surgery, not because they can't tolerate the machine, but because it will fix it in most cases, and they won't have to wear a machine at nighttime. In my case, I really didn't care. It wouldn't be worth getting double jaw surgery for me. I wouldn't never have done this route I would have preferred wearing the machine every night, this oxygen machine. So I basically, what happened was I wanted to look into being a nose breather, but then when I heard the double jaw surgery, I decided against it. But a year later, I basically was backed into a corner where the only way I could solve my sleep apnea was to have these two surgeries. It's a series. It's a whole journey that I'm about to start. So the first surgery is called SARPE, surgically assisted rapid palate expansion. And as I said, they're going to cut my jaw on the side, down the middle, drill in the expander that I'll wrench open. At that point, I'm going to have a very big gap in between my teeth once it's fully expanded. So after that, I'm going to need to have orthodontics to Invisalign or braces to bring my teeth back into looking in a normal straight way. But my bite will not be good because my top jaw has been expanded, my bottom is not in alignment. So after all of this will probably take, including the braces, which could be 6-8 months, I don't know, maybe even up to a year, I'm not sure, plus the initial 6 weeks of wrenching the palate expander open. Then I would have the double jaw surgery, which is breaking the upper jaw here, breaking the lower jaw here, breaking the chin, moving everything forward, connecting it all with plates and screws. And that's the really, the SARPE surgery is a serious surgery as well, but the second surgery is, overnight in the hospital, mouth wired shut for a few weeks, and a major recovery, can barely move your mouth for months, and liquid diet. So yeah, that's basically what's going on. It's a really scary path ahead. I'm 44, I think I'm almost 44. I forget if I'm 44 or 45. I'm 44, almost 44 years old, and if you look up complications for both of the surgeries, it says that the complications go up after 30. So this is all just a really scary thing to be going through because I'm worried about complications. As I can only explain it that I just basically feel backed into a corner because I want to solve the sleep apnea. I really wish I didn't have to have these surgeries, but I have no choice now. I really especially wanted to share this story, and I plan on sharing the rest of my journey throughout with people who I might help to diagnose their own problems, or maybe you're Googling that you're having sleep apnea and you don't know what the problem is, or this or that. And also, if you have children and you don't know about, taking care of their lip or tongue tie and getting it released, a lot of people think it's like a fashionable thing to do that, but it's actually coming back in. People are becoming more educated and know about it more. It's not that it's becoming an in-fashion thing. Midwives used to keep a long pinky nail and just slice it immediately upon birth. So this is like a very, very typical birth defect that is called like a midline problem, lip tie, tongue tie. Some boys even have, I forget what it's called, but the penis hole is too high or too low, and it's all connected to the midline problem, and it's pretty common birth defect. So just slicing that and taking care of it at a young age would, prevent this whole series. My neck is curved in the wrong direction. I have chronic pain in my neck, and my whole body is thrown off. I just had calcific tendonitis in my shoulder because I lift my toddlers all day long, but I don't have good posture because of my neck being curved wrong. So everything I do, I got this calcium deposits and this I had to get an injection. I have physical therapy for my arm. Everything comes back to this tiny piece of skin under my tongue that has set this whole chain reaction of, ailments, the worst of which is the sleep apnea. So anyways, that's the whole story and the gist of it. And thank you for listening, and I hope this is helpful.